And this webinar is what we've been doing in the last 3 years, bringing experts in different fields to discuss emerging issues in the area of biosecurity and One Health. For the month of May, we'll be focusing on opportunities and challenges for scaling up vaccine production in Africa. Like we know, one of the things COVID taught us was the importance of vaccine in addressing emerging biosecurity threats globally. But because of the increase in biosecurity threats in Africa, Africa accounts for a very high usage of vaccine on the continent. But despite the fact that we're using vaccine so much on the continent, production of vaccine on the continent is very minimal. In fact, Africa accounts for, I think, less than 5% of the total vaccine production in the world. So it has become very important considering the high level of emerging and re-emerging infectious diseases and viral diseases on the continent that will scale up vaccine production in Africa to address emerging health challenges. And that is why my organization, Global Emerging Pathogens Treatment Consortium, is focusing on the issue of vaccine for the May edition of the webinar series. Before I move on, please permit me to talk about my organization a bit for those that are joining us for the first time. My organization is Global Emerging Pathogens Treatment Consortium, and it's an organization consortium that was set up exactly 10 years ago. We are celebrating our anniversary this year. The organization was born in 2014 at the peak of the Ebola crisis that ravaged a lot of countries in West Africa. It was clear during Ebola that countries on the continent lacked the capacity to cope with such level of health emergency, and there was a need for an indigenous organization that will continue to work with both government and non-governmental organizations to build their capacity to cope with emerging biosecurity threats. And my organization, Global Emerging Pathogens Treatment Consortium, was one of the indigenous-led organizations that was set up during the Ebola crisis. And in the last 10 years, we've been working with both governments and non-governmental organizations to build capacity to cope with emerging biosecurity threats. And we've used different platforms, been involved in building capacity of different health workers, both at the state and national level. We've developed policy briefs, and one of the platforms that we're using is also this webinar. My organization is registered in Nigeria, in Ghana, Sierra Leone, and also in the United States of America. But our headquarters is in Lagos, Nigeria. So in the last 10 years, we've been working with both governmental and non-governmental organizations to build capacity to cope with emerging biosecurity threats. And today, in this webinar, we'll be focusing, like I said, on opportunities and challenges for scaling up vaccine production in Africa. We say a very big thank you to our speakers. We have some set of wonderful experts in the field, so on the subject matter that I'll be speaking with us today. And we'll say a very big thank you to them for being part of our program this afternoon. Without wasting much of our time, we'll go straight to our speakers. And we have three very top experts on the subject matter today. Our first speaker is Dr. Nikais Ndembi, Professor Nikais Ndembi. I hope, Prof, I pronounce your name very well. Second speaker is Mr. Undari Mugeni, and our third speaker is Mr. Natalia. So we'll go to our first speaker. Our first speaker, like I said, is Professor Nikais Mundari. Professor Nikais Ndembi. Prof is a Senior Advisor, African CDC Director, General and Research. He will be speaking to us for 20 minutes on strategic approach to developing and implementing policies, frameworks for scaling up vaccine production in Africa. So without wasting our time, I'll read a bit of Prof's bio and will hand over the floor to Prof to take over. Please give me 1 minute to read his bio. Let me check for his bio and read. Professor Nikais Ndebi is Senior Advisor, African CDC Director General and Research. Prof is a Senior Advisor to the African CDC Director General and currently Associate Professor, Division of Epidemiology and Prevention at the Institute for Human Virology, University of Maryland School of Medicine, Baltimore, USA. Professor Ndebi is a graduate of Kanazawa University School of Medicine, Department of Viral Infection and International Public Health in Japan, and a research professor within the same institution. He is a principal investigator on numerous grants, including U.S. National Health Institutes. He is the editor-in-chief of the Journal of Public Health in Africa, its research and therapy, and several on various World Health Organization and U.S. National Institute of Health Studies. Prof, well, thank you very much for being with us today. I hand over the floor to you to speak to us for about 20 minutes. Thank you, sir.
No, thank you, Dr. Ayodotu Bobadui. Thanks so much for inviting me. I'm going to take about 15 minutes. Hopefully, you can ask questions subsequently. Can you see my screen, Doctor?
Yes, I can see it clearly, and I can hear you clearly too.
Yeah, I think the topic for this discussion webinar was around strategic approaches to designing and implementing policy frameworks for scaling up vaccines production in Africa. I think this is it's a very interesting topic on its own. I just want to be sure we all agree that we have a very long history on local manufacturing or production, either Nigeria, you know very well the history of Nigeria on vaccine production, either animal or human. And you know the whole history of Africa with Institut Pasteur. This is one of the centers producing vaccines for over 70 years now, 7 decades. So it means the history of production is not new. We should talking of expansion in terms of local production. So let me narrow the conversation to address the topic at hand. So for those of us attending this webinar, I think again, I thank the organizers. I wanted to provide a little bit of background because when we put the topic in isolation, it makes a little bit difficult to understand why are we talking of local production. So what I wanted to do is let's bring this roadmap here. I think since at least the 1800, if you look at it, we have been talking of cholera. The first cholera pandemic, it's actually around 1817. But I can tell you, we're still dealing with cholera in 17 African Union SADC member countries. Can you imagine? So over 100 centuries after, we're still battling. And we're not battling to respond, we're battling because we do not have vaccines to respond to cholera vaccines in over 15. I keep saying that more than 15 African Union member states still unable to have access to vaccines. And we're talking of universal health coverage. I think I'm pointing to this really basic one to say if cholera is a challenge, these days where we have access to technologies, we have access to artificial intelligence and the best tools, I think it's a bit concerning. So let's leave cholera. We jump a little bit from the 1800 to the 1900, a century after. You see again there, the sixth cholera pandemic. Again, we're dealing with cholera. And then within the Spanish flu, which was something a little bit closer to COVID that we had to deal with in the early 2020. So, and then Ebola, I think I'm not going to come back there as the organizers part of this journey on Ebola as well. At least we know that 10 years ago we had to deal with the Ebola outbreak. I think a lot of these things, a lot of these diseases, a lot of these emerging diseases, they are not new to us. We just have to be sure we have the right responses, also the right tools to be able to respond. So before I maybe forget as I deal with this topic, there are 5 key components, regardless of Ebola, regardless of COVID, regardless of chikungunya, Marburg, that we all have to grasp. We need to really address this so that we can tackle any pandemic, any epidemic, any syndemic. So the politics. Why is it that we still have to deal with these diseases over time? Why is it that Africa still has to be at the back of the queue, begging for these vaccines and some of these countermeasures? I think we need to start asking those questions without sugarcoating. What are the population dynamics? We should be able to deal with something and learn from it. How is it that we still have to deal with this cholera, Ebola recurrently? What are the policies that we have in place to address those ones? What are the partnerships have we built over time? Are we not having the right partners to address these public health issues and the pathogens? As you see, this map is really colorful of different diseases, different genes, pathogens. But again, the bottom line is that if you address the politics, how the population's behavior is, the policy, the partnerships, and the type of the pathogens we're dealing with, we might be able to be closer to some of those answers. I think it's not new that we're going to deal with this for over and over with climate change and urbanizations that is going on, that this is going to be with us probably the rest of our lives. So what is most striking is this map that you all have probably seen differently, which I'm bringing it on a different format. So when COVID struck the African continent, it took us more than 6 months. I was at the center of the COVID-19 response and the vaccination strategy of the African Union and the Africa CDC. I can tell you this time around, we were most prepared than ever. The African continent secured $2 billion US, but we couldn't have access to the vaccines. I'm saying $2 billion US, not 2 billion naira or 2 billion franc CFA. $2 billion US is a good amount to secure almost 70% of the vaccine for the entire continent. But we couldn't have access to the vaccines. We couldn't. The high-income countries ordered all the vaccines. The manufacturers couldn't sell us the vaccines. It was quite challenging. As I was at the center, I could see our head of state, I would see our leaders, Mr. Strive Masiwa, President Benedict Orama from Afreximbank, our director, John Tengason, all the fin flare of the intelligentsia of Africa trying to get access to the vaccines for our own people. But we couldn't just have access to the vaccine, which was a strong call for us in terms of what do we have to do next. If now we're not going as a beggars, begging for vaccine, we're going to buy or procure, but we are not denied access, what do we do? So again, this really led access, and which we push it strongly, universal health coverage, which is linked to access. We couldn't have that. and which the numbers that you're seeing, almost 3 years down the road, only 36% of the entire continent had at least access to one dose of the vaccines, when the rest of the world had high-income country already vaccinated more than 70%. This global inequity is unacceptable. And we felt it's time more than ever to build capacity on the continent, to manufacture locally, to bridge this inequity, to stop crying as we do all over. But this time, we cry with the money in our hands. So Africa now decided to really look forward in terms of self-sufficiency, self-resilience as our second independence, to really build a deep localization, local manufacturing, not only for vaccines, because the topic here at hand is around vaccines, where we import 99% of all vaccines that you know. We all import those ones. It's not good for our global security, for our health security. We also import more than 70% of the drugs and more than 99% of diagnostics devices that are used to test. Again, if you cannot test, you cannot treat, you cannot prevent, I think your health security is out of your hands. I think this is why it's so important that we bring this component not only in the context of vaccines, but all countermeasures. What does that mean? If the new outbreaks strike now, again, like at the pace like COVID or any other disease X, Africa will still be behind the queue. We're still going to be begging for all those essential commodities. As you see the numbers, the figures are there. We cannot produce enough to detect our own 1.5 billion people that we love on this continent. We cannot prevent those 1.5 billion people, and we cannot treat more than half of those that we actually love on this continent. So the question is, what is our problem? I think the problem is ensuring we empower our local manufacturers to be able to produce those products, either devices for diagnostics for therapeutics, and for vaccines. What do we need to be able to do that? I think this is where the topic comes in terms of the policy. What do we really need to take into consideration? First and foremost, there's a clear and social benefit for investing in biomanufacturing in Africa. It's important. We cannot underestimate the power of local production. So we talked about it already, health security. It's important as part of our capacity to respond to some of those emerging and re-emerging diseases. I think I can tell you, hopefully you can remember that HIV/AIDS, 60% of the whole HIV population is in Africa, but I can tell you we do not manufacture any single diagnostic test for HIV in Africa. All those tests are being procured to test a new infections in Africa. Why are we not able to diagnose our own HIV test almost 3-4 decades after HIV? I think in 1982, I mean, you can all do your mathematics. Almost 4 decades after the virus was isolated, Africa cannot diagnose, just a rapid diagnostics. But we procure almost 1 billion rapid for cost of diagnosis, almost $1 billion of dollars every year actually be used to procure diagnostics for Africa. It's still very unacceptable, understandable for all of us here. So we need to improve the regulatory harmonization. It's important that we regulate some of these products through our national regulatory authorities on the continent. Because if you actually produce, if you don't regulate those products, if you don't have controls on the regulations, is as equal as not being able to have access to the global market. So again, some of the key high level, we need to build technological expertise and capabilities on the continent. And you also, please remember this, less than 2% of global research and development projects are actually ongoing in Africa, less than 2%. How would you be able to trigger research, science, and innovation if you don't do actually the real research and development? I think these are some of the impediments that are actually crippling the development of Africa, and again, not being able to enable us to move deeper into local manufacturing, because manufacturing will require that you actually drive science and innovation and technology. If you cannot develop, if you cannot have research at the continental level, only 2%, how would you be able to locally produce or manufacture? How would you be able to have the countermeasures to respond to some of those disease outbreaks? I think our hands are really folded, and it really requires that for our economic growth, that will increase local manufacturing. Africa alone represents 25% just for vaccine of the entire globe market. But shamefully, we cannot even do 2% of the global research. So we end up being consumers. We consume everything like aspirin, we consume vaccines, we consume some basics. So I think we need to change to drive really some of these responses where we really have been affected. Lassa fever, Marburg, Ebola. This is not the global North priority. These are our priorities. So I'm going to really focus, and that's the core around the policy, if we really want to drive subsequently local production. So there are actually 8 key elements. And I can put 7th. Let's put 7th element, which represent the enablers. If we really want to manufacture, we need to start where I mentioned to you earlier, research and development. How do we build capacity of NIMA, the Nigerian Institute of Medical Research, for example? This is an example out of thousands in Nigeria, out of millions institutions in sub-Saharan Africa, in Africa. How do we empower them? We need to increase domestic resources to ensure that the young scientists that actually in those institutions can do research. The young scientists are empowered to innovatively think and build partnership to be able to discover. I think R&D should be at the core and the center of what we're doing. So if you do R&D and you build strong research ecosystem, it means that you can have product. Maybe you can talk about tech transfer and IP, intellectual property. If you're a consumer, you don't have intellectual property. You are a consumer. So it means that research and development, new product, intellectual property, tech transfer. So we need infrastructure. We don't need research institutions that are just building. We need to train young scientists. We need to invest into those scientists, upskilling, stop brain drain, bring those young African scientists in the diaspora to come and work on the bench in Africa to address public health related issues that we have to deal on a daily basis on this continent. We need to strengthen the regulatory environment system. I mentioned earlier, if you have a product, if it's made in Africa, if it's not regulated, WHO PQ'd and so on and so forth, you will not be able to get access to the global North market, even the African market. So we need to stop that silo. We need to be sure we strengthen capacity of our national regulator, the NAFDAC, the Ghana FDA, the Egypt FDA, all those that have achieved maturity level 3, to be sure that they actually can make decisions for product in case of an emergency. As I've said it, if we have a new disease outbreak now, we're still going to be on the queue. begging for those diagnostics, therapeutics, and vaccines because we are not doing the right things. So we need to put access to finance. How do we drive our government to invest into health care, to research and development? The Abuja Declaration. How many countries are putting at least minimum 10-15% of their GDP into health? We're just behind, and we spend $800 billion every year for health-related issues. Those $800 billion, if we had invested earlier, we would have stopped this bleeding and be sure that we actually put those money or put those funds into R&D and other systems. We have systems issues. And then finally, market as we build policy. How many countries are consuming made in Africa product? We need to start procuring made in Africa product. The vaccines made in Dakar, yellow fever, should be consumed or actually used in other parts of Africa. A vaccine made in Nigeria should be made to be used in South Africa. A vaccine made in South Africa can be used in Egypt. We need to break those barriers, trade barriers, economic barriers, and others to be sure that we drive biomedical manufacturing across the continent. So, having said that, the African Union is very committed in ensuring that we coordinate this effort. And we have done it during COVID, and we're still doing it during the inter-seasons, in the inter-pandemic seasons. As I've said, the next pandemic is just next door. So we have to use this period, this season, to be able to build the systems, to be able to address some of the critical issues around data sharing, pathogen access, benefit sharing, R&D, and some of those sticky, very important components to drive local manufacturing. We need to build the market. We need to work closely with Gavi, UNICEF, WHO, other procurers to be sure that there's a free and independence of Africa to be able to manufacture and move product across the globe. I think I've talked about the enablers. I talked about some of the initiatives from the African Union, the African Medicines Agency, the Africa Vaccine Acquisition Trust. During COVID, we were able to break barriers, break the global architecture by establishing pool procurement and having access, at least building or bringing more than 40 Africa member states together to procure vaccines for Africans. I think we need to continue that. It's very important as we really shake the global health architecture. We need to expand our own capacity, and it's extremely important as some of the enablers and progress from the African Union Commission. But let's not think Africa only. We need to think regionally. It's important. See, if Africa, we cannot produce the 60% of all the vaccines by 2040, that's the target, at least we can start working as regions, because the issue Africa faced was the same issue faced by other low middle income countries. I think putting our heads together and building the same structure, product regulation, policy and governance, business archetypes, healthy market, financial models, R&D, tech transfer, those are the same issues countries like Brazil, countries like China, countries like others actually facing. So the South-South collaboration is extremely important in building a regionalized vaccine manufacturing collaborative. Africa, we established what we call the Partnership for Africa Vaccine Manufacturing. The rest of the world, we're actually putting what we call a regional vaccine manufacturing collaborative, which is important. If there's a travel ban, if there's an import ban, we can rely on that South-South collaboration to make things happen. I think I've talked about what is required. We again need sustainable business models. We need healthy market. I am going to just conclude on that. We need to encourage the private sector and ensuring that they invest and put in money with the business. How are we sure that Aspen, we're going to produce vaccines and get a market on the continent to be able to sustain local manufacturing? We're going to do that if we can definitely consume our local product. So we need to really scale tech transfer and workforce capability, coordination around supply chain and infrastructure. And again, as I mentioned, build that regional and equitable governance model and harmonize our regulatory and regulatory systems. So in conclusions, we need to really start discussing the economies of scales. How are we going to produce the vaccines for health security at the cost probably covered by our own government? We cannot compare the cost of the vaccines produced in India versus the cost of vaccine produced in Africa. India went a long way to get where they are. And it's important that we start investing to be sure that 40 years down the road, we're where India is, and also we can get access to the global market. Strengthening regulatory systems, I think, is a really low-brainer here. We definitely have to do so. Africa must have confidence in Africa, in consuming made in Africa product. Workforce development, we have the youngest populations in the globe. How do we train, retrain, upskill, and stop brain drains and probably reverse engineer the brain to Africa and also build on the artificial intelligence to really bridge the gap around workforce development. Again, innovative research and developments. We've seen the pandemic agreement. The rest of the world failed to meet an agreement. But Africa, we should keep pushing. We should keep pushing and ensuring that that global inequity is addressed. Innovative financing, we need to invest, bring our own money to the table, and be sure that we're not going into negotiation as beggars, but as contributors in science, innovation, and technology to drive local manufacturing. Thanks so much, and back to you, Chair.
Thank you very much, Prof, for that very interesting presentation and very enlightening presentation. I gained so much from your presentation, and I'm sure most of those on this platform have gained so much from your presentation. Like what Prof said the next pandemic is just around the corner. And to refresh our memory, Ebola in West Africa was in 2014, that is exactly 10 years ago. And COVID started in 2019, that was exactly 5 years ago. Becoming clear that the cycles of these emerging infectious diseases are reducing, and we have to do all we have to all that is needed to be done to make sure that we're ready for whatever can come next. We don't prepare for war, during the window period that we, like the window we have now, that we prepare for the next pandemic or epidemic we might have in Africa. So the time is ticking. We need to pull in all the strategies, the policies, the strategic innovations, and the collaborations that we need to put everything together with the leadership of African CDC to make sure that Africa is ready for whatever health challenges that we might face in the nearest future. Thank you very much, Prof, for that wonderful presentation. And for those that I'm sure there will be a lot of questions for Prof, just go to the question and answer section of the Zoom and write your question there. I'm sure Prof will be very happy to respond to your questions. And at the end of the presentation,
Hello everyone, can you hear me? We sincerely apologize about the technical glitch. So right now we'll be moving on to the next speaker. And the next speaker we have is our next speaker for today is Dr. Mr. Onzari Njeni. So I'll be reading Mr. Onzari's biography right now. Mr. Onzari has more than 18 years of experience in public health at basic science, programmatic, and policy levels. His work has included establishing infectious disease surveillance platforms, field clinic and laboratories, developing, monitoring, and overseeing implementation of topically focused epidemiological research, surveillance, including multi-country, multi-site setup, and multidisciplinary teams, through collaborations with governments, research and academic institutions, and investigating disease outbreaks. These platforms have been utilized to evaluate vaccines, support governments, collaborators, and partners to generate relevant evidence for vaccine introduction. Additionally, he has been part of teams that have provided programmatic support to develop policy and enhance systems that facilitate the vaccine ecosystem, including being called upon to participate in forums that are charting the vaccine sufficiency roadmap on the African continent, and to build networks that addresses the specific needs that only towards optimal vaccines availability, but also to ensuring delivery and uptake where they are needed. Ondari has worked at the International Vaccine Institute since 2015, assuming various roles as infectious disease epidemiologist on typhoid, cholera, and AMR projects, and currently serves as the Government Relation Manager for Africa in the Global African Communication Department in the Office of the Director General. Overseeing the institution's engagement on the African continent. He has also chaired the Health and Safety Committee. Before joining IVI, he worked at Kenya Medical Research Institute and Center for Disease Collaboration, with his last assignment as the Population-Based Infectious Disease Surveillance Aid Program Coordinator, overseeing the International Emerging Infectious Program. Beyond his professional competencies, his professional and personal endeavor and civic duty mirror the ideas of empowerment and community-oriented objectives. He serves as the board of Curiously Endeavor Trust Initiative, KETI, whose objective is to advance the principles of self-reliance and locally sustained development at the grassroots level in Kenya, and the Management Committee of Nairobi Music Society, and is a member of the Rotary Club of Westland. He holds a diploma in clinical medicine and surgery from Kenya Medical Training College, Nairobi, Bachelor of Arts from Daystar University, Nairobi, and a Master of Science in Public Health from London School of Hygiene and Tropical Medicine, London. Ondari's research interests include infectious disease epidemiology, vaccines, antimicrobial resistance, and policy, and has authored more than 50 publications. Mr. Ondari, we are very glad to have you here. Thank you for joining us. And please, you have the mic.
Thank you so much, and thanks for the introduction. I hope I am audible, and hoping that technology will not play games on us. I guess I'll build up on what Professor Nikes has started presenting, and in this case, looking at what are the available strategic opportunities that we can leverage on for vaccine production capacity on the continent. And I thought a good way to begin will be briefly talk about who the International Vaccine is. And essentially, we are a United Nations Development Program offshoot founded in 1997 with a mission to discover, develop, and deliver vaccines to low and middle-income countries, and in particular, dwelling on unincentivized vaccines whereby there's no much work being done. And we, as an international organization, we have member states in about 40 countries, with some of them in the process of accession. And we have offices, we are headquartered in South Korea, with offices, a regional office in Europe, and also a regional office on the continent, with a couple of country offices, one in Europe, one in Africa, and then 3 collaborating centers. Now, as I mentioned, we sort of work across the value chain, as you're able to see, in terms of discovery, in terms of development, in terms of delivery, in terms of epi surveillance, and building up on what Professor Nikes said. At the end of the day, in as much as a vaccine has to be developed, if it doesn't go to the right place in terms of delivery and access, then it's essentially useless. I think when you look at the work we have done as an institute, it's worth mentioning that the OCV is one of the in-house products that we worked on with tech transfer to industry. And currently, as we know, there is a limited global stockpile, with U Biologics being the one that is currently producing more than 90% of the OCV. As much as work is being done to other manufacturers hoping to scale up that availability. And as we do know, cholera is one of those diseases that there is a huge burden on the continent. And someone did ask, what about the patents that are accrued from some of that work? One of the things we do is that we ensure that we do not take patents of the work that we do. And in as much as one of our mandate is not to manufacture, so when you do tech transfer to industry, is then to ensure that there is an opportunity to produce those vaccines at cost to make availability easier. To take us back to COVID-19, as we do know, I think we all have our different perspectives. We went through different experiences, but one of the things was basically not only availability of vaccines, but availability at the right time. Professor Nikes noted that I think a substantial amount of resources were mobilized, but then again, there were no available vaccines. We tended to have words like nationalism by various countries. Unfortunately, as you'll be able to see, I was looking at this the other day, while we have had almost more than 2/3 of the world's population having received at least one COVID-19 vaccine, when you look at the low and middle-income countries, at least only 1 person in 3 have been able to receive that one vaccine. And whereas when you look at the high middle-income countries, again, almost you will see 3 in 4, as I alluded earlier, have been able to receive. But then when you look at the number of vaccines the doses have been given, how we were disadvantaged, and there are many factors that came about. But then one could say that COVID was a silver lining, as we're able to see. And the question is, will we leave that silver lining? Will we squander the opportunity, or is it a chance to ensure that we'll be ready for the next pandemic? And when you look at it, unfortunately, when you look back at COVID, there are quite a number of things that came up in terms of the inequities, and which are likely to play if we don't address them into the next pandemic. When you deal from diagnostics, R&D, to manufacturing, to vaccine supply, and to ultimately ensuring that what is available goes to the population that needs it most. And so those are some of the issues that we need to tackle, deal with, if we want to be able to be ready for the next pandemic, and not only to be ready, but as a continent, that we can be able to have our health security, can be able to be ready and ensure that we can be able to address the needs of our population. When you look at the Global Action Plan from 2011 to 2020, it listed about 27 vaccine preventable diseases. But as you can be able to see in the middle, some of them were not there. And we are starting to see reemergence, like dengue, that was in one part of the globe, now spreading across. Then we did have things like SARS-CoV-2. And then also when you look at recently, I think the WHO did release pathogens that are considered by high priority in relation to AMR that needed to be given attention. And then look at to the right and to the left, some of them are amenable to vaccines, which says that as we go the race against AMR, there's an opportunity to utilize vaccines to stem the tide of AMR. But you realize that as the world keeps on evolving, as with climate change, with more human-animal interaction, the question is how many more diseases will need to be added, which in itself adds more pressure. Then that brings that to the continent to be able to have sustainable vaccine manufacturing. And it has to be a holistic process that starts from innovation in terms of R&D, that has to be continuous to be able to generate the burden, to be able to identify which needs to be the priority diseases, such as like what Africa CDC has been able to identify. And then technology transfer, it should be able to be available and readily available without having a lot of restrictions. And then how we should be able then to build the manufacturing capacity such that I think we can not only be able to manufacture, then we should be able to regulate what is manufactured on the continent. And then how do we create the demand? We need to engage governments, the NITAG, scientific, a group of experts, such that by the end of the day, we do not want to create white elephants, manufacture vaccines that we may not be able to utilize, or have an avalanche of very many people or governments that want to manufacture vaccines, and ultimately there will be no delivery, there will be no uptake, such that then it will be a waste of resources and time. We need to build the human capacity that is required. What we see right now is that most of the people on the continent who have the expertise end up being taken up elsewhere. How do we ensure that we can incentivize the experts that we have to be able to remain on the continent and to contribute to this journey? But ultimately, it has to be a holistic process to be able to be objective and meaningful. When you look at it in the context of R&D, you will realize that I think on the right side, you have mortality, and then on the horizontal side, you have in terms of the various diseases where research is going on. And then look at, there's a high proportion of relevant diseases, you can say, with high burden, tuberculosis, HIV, and malaria, but there are a lot of R&D that is ongoing. And cognizance of the fact that in as much as all that, most of that is happening, again, unfortunately, is happening out of the continent. So we end up being more of the consumers of most of this work. And then again, you do have, depending on one looks at it, there might be low priority diseases with low burden, but again, not much R&D is happening. And then we do have where we have quite a number of high burden diseases that are disproportionately affect us on the continent, where there is need for more research and development, where there is need for more work to be done in terms of vaccine development. But again, minimal work is happening. And then Professor Nike's alluded to the fact that we almost have less than 10% of R&D taking place on the continent. But again, even when you come onto the continent, you realize on the left side, almost of the R&D is within very few diseases when you look at this. And then on the right side, even when it comes to the places where R&D is happening, also it's happening in very few countries, as you can be able to see. This list may not be exhaustive, but again, it also shows even intracontinentally, the strengths we do have and potentially the disparities that might be there, which begs the question, how do we synergize and leverage on the strengths that we do have to be able to pull each other together? How do we work together to ensure that the R&D aspect on the continent can be able to increase and meet the needs of the continent? And then when you look at on this slide, it tries to show that when you look at the high profile disease, and in this case, HIV, malaria, and then you look at diseases that the burden might be high, not much is known, and not much, there's need for more data. And then you look at in terms of funding, when you, for instance, the group A strep, INTS, Shigella, and schistosomiasis, most of them neglected tropical diseases, the amount of funding in terms of millions of dollars, which is about 27.9, and then you look at even individually at my HIV and malaria, TB, even individually, they're way more than those four combined. Then which begs the question, as we prioritize as we prioritize the priority diseases, the priority pathogens, targets, how do we also ensure that funding is channeled to the rightful diseases that we need to tackle? How do we influence our governments to ensure that they can be able to meet some of their objectives in terms of funding that needs to go to R&D, coming from the Algeria Declaration, I think, of 2006, to the Abuja Declaration, the Algeria in terms of research, not extremely less than 10 countries have been able to meet that target. The same thing to, funding that goes into healthcare. So the question is that how do we ensure R&D on poverty-related neglect diseases can be turned into an opportunity, then can be a model for vaccine manufacturing, because it will be addressing the diseases that affect us. So one of the things is that at the end of the day, you should be able to regulate what you can be able to manufacture, either locally or regionally. And when you look at, as of October last year, there are about 15 national regulatory authorities listed on WHO for vaccines, either for producing one and producing at either maturity level 3 or maturity level 4. And out of those, you realize that I think only Africa right now, and when you look at vaccine producing, you only have Egypt and South Africa that have reached at that particular level. Of course, other countries in terms of both medicines, then you have Ghana, and then you have Tanzania for medicines. And there's a lot of work has been done, be it throughout the NEPAD. Now we have AMA that is being set up. The efforts that are happening regionally between countries, supporting each other, to have many more countries at least attain maturity level 3, because at the end of the day, it's one thing to be able to produce, but then it cannot be regulated. Then it brings its own challenges in terms of access, or both beyond the borders of that particular country. Which brings to this ambitious project, our ambitious goal, that almost 90% of our vaccine needs we have to import. Yet there's this ambitious target by Africa CDC and PAVM before. Now the name is changing to Platform for Harmonized African Health Products Manufacturing, because of the expanded mandate given to them by the heads of state, that by 2040, we should be able to have manufactured 60% of our vaccine needs. And in so doing, the hope is that then we can strengthen our pandemic preparedness, our continental health security, and be able to tackle endemic diseases that are of priority to us. In line with that, you realize there's a lot of two things have happened. Quite a number of governments have made announcements that they do want to do vaccine manufacturing. I think the question is, should that be done by everyone, or should then, under the stewardship of institutions like Africa CDC, say regionally, can country X take that leadership, so that again, we don't do manufacturing for the sake of it? And of course, some of the countries have made headway, others are at the nascent stages. Then in line with that, we have a lot of funding that has been committed into vaccine manufacturing. How do we then turn this funding into not only sustainable utilization, but equity in terms of preparing for the next pandemic, and also addressing the real needs of the continent? And for that reason, I think we believe that there's need to have a new approach that ensures not only the capabilities on the continent are optimally exploited, local manufacturing is made a reality, there's an enhancement of R&D on the continent. And then you realize there are many institutions, one could say even IVI, that we come do the work and probably we do leave. So you have a lot of top-down approaches that are being taken on the continent. How do we ensure that all these initiatives, they are very well coordinated through projects, they are holistic, so that at the end of the day, they're impactful and realizes the priority needs on the continent? And I want to in that respect, briefly talk about, okay, my slides have stopped. Okay, yeah, I want to talk about one of the initiatives we believe that can help, that we believe we require a holistic end-to-end ecosystem in ensuring that vaccine manufacturing, it can be a reality and be sustainable, and leveraging on the existing expertise on the continent. Hence, this idea or initiative we're calling Advanced Vaccine End-to-End Capabilities in Africa, that should be an initiative that is able to address these needs, which is in line with the offices that we have been able to now establish on the continent, being the regional office in Kigali in Rwanda, and then an AVEC office in Nairobi that should be able to drive this initiative. And Professor Nikei's alluded that PAVM, which is now FARM, has this 8 framework of action, and he tackled 7 of them. And we strongly believe that through AVEC Africa, we can work with Africa CDC, with other partners, to be able to strengthen the national regulatory authorities, ARCO centers of excellence, to be able to enhance the technology transfer, to be able to increase R&D, and also capacity building by training more human resource. I'll keep on going back to the priorities, because without doing that, then we might be dropping in the dark. And by so doing, we can be able to mitigate the gaps that exist, be it in epidemiology, in lab research, in vaccine development, whether it comes to registration in respect to NRA, and when it comes to manufacturing, ensuring that we can have manufacturers who will be able to come up and will be able to be sustainable. And in the long run, we can have vaccines that address our needs. And a good example is, as I highlighted earlier, we have a limited stockpile of OCV, and right now we have U Biologics as the only manufacturer. But then 2 years ago, we did a tech transfer to BioVac South Africa, which is a good initiative, working with the relevant partners, including Africa CDC, because I think if this progresses rapid as expected, then we will have the first continental company that will be able to produce a vaccine that is of need. And so we have done tech transfer to them. They're working with the relevant teams, both at IVI, to be able to go through the process. And the idea is that to work with them to the very end, up to a point of WHO pre-qualification, such that we can have a product not only can be regulated in South Africa, but also can be accepted regionally and globally, and can be able to be utilized for control of cholera epidemics. And also, this also gives other examples of other projects. I've talked of the OCV. Then the other one is Lassa preparedness for having clinical trial sites that can be ready to launch any trials that might be there. I mean, we had a lot about the mRNA technology during the COVID-19, which can be leveraged for other vaccines. In this case, we are working with Africa and South Africa, who are the lead, because we believe that institutions from the continent should be the one who should be in the driving seat, with IVI in this particular case being one of the sub-awardees to provide the technical expertise. And then, of course, all working with institutions to develop grants that, in so doing, also developing capacity. Ultimately, the hope is that we then can be able to work on and incentivize vaccines that affect diseases that have a negative impact on the continent, such as schistosomiasis. Because at the end of the day, when you have a healthy society, then it can be more productive and you can have more development. And in so doing, we believe that it has to be a holistic process, as I alluded earlier, that needs to start with the need, resulting in innovation, in discovery, then being able to develop, generate the burden data that is required, and then inform decision-making in terms of the vaccines that need to be developed, and then going all the way to not only develop those vaccines, doing the tech transfer to industry, and ensuring that then those vaccines are manufactured, and then working with the relevant institutions to ensure that those vaccines reach the places they are needed most. With that, thank you, and look forward to the discussions. Back to you.
Thank you very much for that beautiful presentation, and for highlighting the needs for Africa to increase our target from less than 1% to 60%. So thank you very much for that. So right now, we'll be moving on to the next presentation, and it will be from Mr. Nathaniel Nkrumah. I hope I pronounced that rightly. So I'll be reading his bio right now. Mr. Nathaniel is a pharmacist by profession and a chief regulatory officer with the Food and Drugs Authority, Ghana. Nathaniel is currently the head of Vaccines and Biological Products Department of the FDA, Ghana. Nathaniel has over 21 years in regulation of vaccines, of medicine rather, in Ghana, Africa, and international levels. He was instrumental in developing several guidelines for use by the FDA, Ghana, and on the African continent through the AU NEPAD Technical Committee he serves on. He played a key role for Ghana FDA towards attainment of WHO Maturity Level 3. He is a team leader for GMP inspections on behalf of the FDA and also the focal person of FDA for the following: in the designation of Ghana as a regional center of regulatory excellence in vaccine regulatory oversight, to AVAREF, his expertise is in complex formulations, sterile formations, and biologicals. He serves or has served as a consultant or member to many bodies and regulatory authorities, such as technical consultant and second assessor on assessment of dossiers for the World Health Organization on pre-qualification of medicines program, technical consultant to European Medicine Agency on review of equitable extension for use in pediatric induction, consultant for WHO at East African Committee meetings, member of African Union Development Agency, subcommittee on vaccine regulatory oversight, member of African Union Development Agency, evaluation of medicinal products technical team, vice chairperson of the EMP subcommittee on various and biological products for AU NEPAD, representative for Ghana, FDA for virtual COVID-19 European Medicine Agency, Pandemic Task Force, member of the FDA, Ghana, COVID-19 Technical Committee of Ghana during the COVID-19 pandemic, external assessor to South African Health Products Regulatory Authority, external assessor to Botswana, member of the Working Group on Lot Release with Rwanda, member of FDA, Ghana, on support for Rwanda FDA towards attaining WHO Maturity Level 3 and or 4 for marketing authorization. His passion for the African continent, his succeed, can be attested in his drive and desire to build capacity within the continent in medicine regulation, including vaccines, and to bring to bear his knowledge and expertise to support Africa. Thank you very much, Mr. Nathaniel, for joining the May edition of GET Webinar Series today. You will now have the mic.
Yeah, good morning, good afternoon. Sorry, can you see my slide, please? Hello, good morning. Can you see my slide, please?
Yes, we can.
Okay, thank you very much. Good morning and good afternoon once again. My name is Nathaniel Nkrumah. I'll be presenting on behalf of the Chief Executive Officer of the Food and Drugs Authority on overcoming challenges in the manufacturing on the African continent for vaccines. Am I in the presentation mode or it's just, okay. So this will basically be my presentation outline, a little brief on where we are and what has been done at the background, some challenges that we have and how to overcome them, and I'll just make some few conclusions as well. So the current outlook is that I'm sure my previous presenters have also mentioned that currently the African vaccine manufacturing industry only supplies 1% of vaccines on the continent. Some work has been done, as have been alluded to by the previous presenters, by bodies like PAFM, who have now changed their name, and other other co-funders. And what they've done is that they've identified that currently there are 13 operational vaccine companies and organizations across Africa. 10 will be doing what we call the fill and finish, and then 5 are trying to meet the demand to demonstrate that they can do drug substance or biologics, and then 3 have conducted extensive research on R&D. What is the future? And as has been said by my previous presenters, 2040 has been proposed by PAVM for us as Africans to be able to meet halfway our demands in terms of the vaccine manufacturing products. What has been done again is that 23 manufacturing facilities have been earmarked, where we have 12 that will be doing end-to-end facilities. That means from upstream up to fill and finish. And 11 will be doing only the fill and finish facility or manufacturing. What is the strategy that has been proposed? There are 3 main strategic objectives. It's for us to be ready for the next pandemic. We don't want to wait like what we saw in the COVID-19 before we are taken by surprise. Of course, again, to develop and produce our vaccines locally, and I'm glad that this topic has been brought to the bear on this infectious pathogens we have to tackle head on as Africans, for Africa and by Africa. And we have to, in doing that, the next concept is whether we have enough vaccines to meet the demands on the African continent. Of course, it comes with challenges, and that is basically what I'll be trying to talk about in the next few minutes. And these challenges are mainly interconnected and co-dependent on each other. Now, I'm sure you might have seen this bullet from Professor Ndebi already, which outlines the challenges that Africa faces or has faced. And I'll talk more on each of them, how to overcome these challenges. So we have, first of all, the most critical thing, which is the finance. Of course, if you have the money, you have the facility, there should be demand for it on the African continent. We don't have human resources to make vaccines throughout the vaccine life cycle and chain. We need technology transfer for those that will be working on the continent. The regulatory authorities have to be up and doing and should be ahead of the industry to be able to guide the industry and to provide guidelines, to provide all requirements at each step of the process until the product becomes available on the market. R&D has already been discussed by my previous speakers. We are too dependent on external supplies, and therefore, as has been said, only 1% of our supplies is coming from the continent. In terms of infrastructure, we only have, like I said, 23, out of which 12 not really ready. Some few are trying to do the fill and finish, and that brings a lot of challenges, because when the suppliers of the bulk cease to exist, those facilities don't have anything to supply. And then the supply chain, how we deal with the cold chain, how we handle these biologics and vaccines is another issue. And the need to have a coordinated process from all the various regulatory authorities, all the various manufacturers, information sharing, in order not to duplicate with our less resources that we have. So let me just speak finances. How do we overcome them? There should be political will. There should be, of course, financial support from industry players, from any other avenue. And this we can do by lowering the cost of loans that will be needed for the manufacturers to access to put up facility, because it's very expensive to put up a manufacturing vaccine facility. Again, just some tax incentives made available to these manufacturers. The land tenure system in Africa should be such that those who are willing to do the fill and finish or the end-to-end stage manufacturing should have access with security guaranteed, such that they will not be along the line be impeded with all the different challenges that we have with our land tenure system. There should be grants for investments, such as if those who are going to import solar panels for use to subsidize electricity and power generation, raw materials for vaccines and biologicals should be subsidized as well. And then one of this critical one is the private-public partnership, where we have supports from those who will be providing the facilities and those who will be funding. Next is on in terms of long-term commitments from governments. So the challenge normally is the markets. Yes, they will manufacture all this, but if the government doesn't have a policy in place to procure such vaccines, then nobody will be willing to go there. So I can give examples where in Ghana, a company wants to do a manufacturing. We had to impress on government to make available the need for the manufacturer to be able to understand that indeed, when they manufacture the various millions of doses, governments will be willing to procure their products vis-a-vis the global ones. Of course, that means that they have to be at the right quality, they have to be pre-qualified and all the other requirements. I'll talk about that when I get to the requirements from the regulatory side. There should be this intra-continental free trade agreements. I know Africa is doing a lot to allow for free trade, but again, it should be very much well designed and structured to support these manufacturers who want to go into this particular product line. There should be pooled procurement such that if a country in South Africa, in Ghana, whichever facility manufactures their vaccines, of course, we within the continent should be willing to purchase such vaccines and utilize them for use. In that case, people will have the need for the market share. There should be trainings on how to identify and evaluate market trends and all the resources that are needed. The next one, of course, another critical part is on human resources. Now, with this, the first time approach will be to get the global experts to come and work in the local manufacturing facilities over a period as defined by a policy, so that these experts will have specific training responsibility to train specific individuals so identified on targeted products such as the pathological infectious disease that we are referring to, and give them timelines. So if an expatriate comes with this offer, we can give them 5 years, after which we will not renew their permits if they don't meet our target. So we can explore other areas. We can send the workforce, some of this staff, to attachments with well-established facilities for a hands-on training, in addition to all the training that they will have, so that they have real-time experience. We can partner with local and international universities with tailor-made courses on vaccine and vaccine manufacturing. The workforce on the African continent is not adequate to meet that demand, and we should quickly start from doing that. I know Rwanda has this great partnership with the university where they train people who are interested in offering themselves for vaccine manufacturing. I know Ghana is also doing a similar one with some of the local companies. We should have scholarships to fund identify talents who are interested in the biopharma space, incentivize those who will be trained so they don't leave the African continent for bigger monies out of the continent. The other one is on how government through taxes can help build the system. And that will come through government support, as I've already mentioned, through taxes on the technology transfer part, because yes, you can't just do it on your own. Biologics are a very complicated type of products which require very extensive expertise in manufacturing same. So the government can support on that regard. We need to have financial support to cover cost of the transfer because it doesn't come free nor cheap. We need to build capacities with various relevant platforms for the various pathogenic infectious diseases that we are looking at, whether we use the viral platform, the mRNA, DNA, or any other platform that we may find useful. To also have a centralized African unit that will be responsible for facilitating the transfer. Because with the little experience we've had with Rwanda and Ghana with the fill and finish, the biggest challenge we've had was technology transfer from the bulk manufacturers for the fill and finish within the various manufacturing facilities on the continent. Of course, we need to identify the global partners with those expertise and experiences who will need to support this tech transfer to be used for the manufacturing of biologics and vaccines on the continent. R&D, very important and has been talked about already by the previous presenters. But of course, we need to focus on specific pathogen high disease platforms peculiar for the African continent. Oftentimes, we try and not do a lot of trending and a lot of research and just jump to join what the world is doing. We have a peculiar situation and we need to develop a peculiar platform for our continent. Invest in infrastructure because it's very expensive to do R&D on biologics. Again, financial support for those who do the R&D from governments will be useful. And we have to collaborate with the funders or those partners with the resources to help with the R&D And of course, incentivize researchers into R&D. This is an area that we need to hammer a lot so that researchers can find place in R&D labs and R&D factories to help to churn out this vision. And to train researchers. So one of the most useful platforms I know is the Afro-Advac, which always churns out training for researchers every year on the African continent. Then the regulatory ecosystem. So we need to streamline our approval process for clinical trials because some of these new vaccines will require clinical trials and not have too many differences among the African regulatory authorities. It's a big challenge for most manufacturers. We need to streamline our processes for approval of such products. And I must admit that the African Union NEPAD is doing a great job before AMA comes into place to have a lot of technical working groups to have processes that are harmonized among the various vaccine pathway from upstream up to marketing authorization and GMP and all the process that go with granting of marketing authorization for vaccines and biologics. Again, we need financial support for regulators to improve their expertise and maturity. So for the continent to do pool procurement, to appreciate that a vaccine manufactured by country A can be used by all the countries, we need to have at least the WHO maturity level 3 for those regulatory authorities who will be doing that function to give us confidence and hope that whatever they've done meets the international standards. Again, to have a platform where manufacturers and regulators can meet regularly to identify and to discuss challenges that they may have. And the testing, of course, before you do this, you need to test the vaccines before it is released onto the market. We need to strengthen the regulatory authorities' capacity to do the testing and do some benchmarking with WHO in that regard. This specific one also refers to the fact that there should be technical working that will be created between the regulators, the bulk manufacturers, and the fill and finish local manufacturers to have a synchronized platform where we all understand each other and not wait till the end stage where regulators will not be in the know of what is done and then they'll keep with their bureaucratic system frustrating manufacturers who want to put product on the market. We need to share work within the NRS where those who are maturity level 3 can share their reports with those who are yet to attain that level. All this is to build confidence within the various NRS so that reports from each other can be appreciated without having challenges on appreciating them. We need to reduce dependency on global supplies. And this can be done if we encourage local manufacture so that we don't have 1% vaccine manufacture in the next 20, 40 years. In the event that a pandemic happens, we may not be that lucky like COVID did to us. And such a pandemic may probably be more severe and damning to us. Food procurement I've already mentioned, and then we need to identify the potential suppliers to work with before we have challenges. The next one is on infrastructure. This is a very expensive venture and we need money, but we need to find out how best to support those who want to go into the venture. I've already mentioned the land system incentive tax, but we also need to support cold chain along the manufacturing platform to have solar, because electricity and power generation is very, very expensive on this part of our continent. So with solar, we can reduce the cost of doing business by these manufacturers, by the train or the chain of the various entities that will be involved with the whole vaccine life cycle, and to support engineering companies who can be of help within the infrastructure scale, whether it's architecture, whether it's electricity, whether it's water. Whatever we can think of, we should try and start thinking about how to support and help such entities. And then to coordinate. So like somebody has already said, the PVM is doing a wonderful job, African Union is doing a wonderful job, CDC is doing a great job. So all these partners can come together in a forum where we can have ideas shared, we can have all the discussion that we want and help us to achieve what we want to achieve. So on that score, I just want to conclude that it is not just one challenge that has to be addressed. It's a multifaceted approach that requires all hands on deck. And by addressing all this, Africa can actually be self-sufficient and not fall foul in the event of a pandemic or towards our specific needs for specific pathogens that may arise along the continent. Thank you very much, and I remain for any further questions.
Thank you very much, Mr. Nathaniel, for that beautiful presentation. For specifying the things we need to do. For instance, mentioning that we should focus on developing specific pathogen eye disease platform peculiar to African continent, which I believe is a very important thing we need to do if we want to develop our continent in the area of vaccine. Thank you very much. So right now we'll be moving on to question and answer section. So we have quite a number of questions, and I can see that some have been answered already. So the first question is, while progress, I think this question will go to the first speaker, Professor Ndembi. While progress has been made, significant challenges remain in achieving self-sufficiency in vaccine production across the African continent. However, there is growing recognition of the importance of local manufacturing to improve access to life-saving vaccine and enhance health security in Africa. What is the level of work done in ensuring that this happens? Over to you, Professor Ndembi.
Hello?
Please go ahead, we can hear you.
No, I think that's been extensively addressed during the course of these presentations. So let me get like 2-3 examples. The first one is around financing. Africa CDC is going to be launching in the next coming weeks with Gavi, what we call the Africa Vaccine Manufacturing Accelerator. And it's a real kind of replenishing funds really to support local manufacturing across the continent. Be sure that we address the issue around financing, because we need a sustainable financing and viable ecosystem. So we are pushing that, and hopefully we get enough funds during that replenishing funds in Paris, led by France and President Macron, so that we can release funds, at least the first tranche of funding to local manufacturers, encouraging them to really embark into this industry. We are working closely with PEPFAR and Global Funds and ensuring, I mentioned earlier, around diagnostics, where we want to be sure that there are local manufacturers for diagnostics tests, particularly for HIV. As I've seen, 60% of those cases are HIV individuals are on the continent, and we procure almost $1 billion per year for rapid diagnostic. We want that money to stay on the continent. I think working with Global Funds and PEPFAR already signed a commitment to support manufacturers that can manufacture rapid diagnostic tests for HIV on the continent. That's on the financing really angle. On the pool procurement, the African Union has just approved during the last our last assembly, Africa CDC to lead the pool procurement of over $50 billion. So we're working with Gavi, UNICEF, and other procurers to ensure that we materialize it. So when we have that pool procurement architecture, it gives really strength, it gives really power, bargaining power for the continent to be able to really start accessing some of the commodities really at a price and ensuring we bridge that gap around universal health coverage and accessibility of health products. I think that's number 2. Number 3, we have been very vocal and recently and ensuring WHO PQ that we fast-tracked it. We've issued several statements, and we're ensuring that we leverage on our NRAs that have achieved some level of maturity, at least level 3, and some are moving towards level 4, and ensuring that not only the 400 and 500 manufacturers on the continent, only 10 that we have currently, but we have more that can achieve maturity, that can achieve actually WHO PQ, and those products can actually end into the global market. I think Africa CDC, we're pushing. I cannot list the long list of trainings that we've been able to facilitate for our manufacturers and those in the industry to attend in Korea, and our partnerships with some of those on the call like IVI that we're working closely and ensuring that there's tech transfer for vaccines like OCV, and that can actually be really pivotal for the response to some of the emerging and re-emerging diseases on the continent. Remember those 8 bold programs? We actually center our actions around those 8 bold programs, the 7 elements, in addition to coordination, communication, collaborations, and cooperation, and ensuring that we address our target of manufacturing at least 60% of the vaccines by Horizon 2040. Thank you, and back to you.
Thank you very much for that. Right now, before we move on to the next segment, I would like to invite Dr. Ayodesun Bobadoye to take over right now. Thank you. Dr. Dotun, you have the floor.
Thank you very much. Let me start by apologizing for going offline. I'm in a place where the network is very bad, and I've been going around my hotel since morning to find the best place to access internet. Well, I've listened to what Prof. Mr. Undari and Mr. Natale, their presentations, and I want to start by saying thank you very much to them for those very educating presentations. I've benefited immensely from what you said on vaccine production, the challenges, and what Africa needs to do to increase production on the continent. Thank you very much for being part of this webinar. We sincerely appreciate your sharing of knowledge and your creating time for you to be part of us today.
Thank you very much, everyone. So before we move on to the next segment, I would like to invite Professor Geoffrey Tangwa. He's raising up his hand. Please, you can go ahead and speak.
Okay, can you hear me now? I was struggling to unmute myself. Can you hear me?
Yes, we can hear you. Please go ahead, sir.
Okay. Yes, I think I thank all the speakers for very enlightening and stimulating talks. I have 2 questions in one. The first question I have is, it appears that we need external funding to carry out our ambitions here as expressed by all the speakers. Are these external funders funding on philanthropic basis, or is it funding with strings attached? Second question, all the speakers mentioned the next pandemic, and some of them even said it was around the corner. How around the corner is the next pandemic? A pandemic is not something that we can envisage very lightly. So my question there is, what evidence is there that the next pandemic is around the corner? Thank you very much. And I'm listening to the speakers.
Let me take this question before my colleagues can jump in on the next. So I think my brother, I think this is Dembe from the Africa CDC. I think it's very likely that we're going to have a pandemic of the magnitude of COVID in less than 10 years. So the evidences are there, global warming, we have seen the frequency at which some of these diseases and the outbreaks are reoccurring. They are getting closer and closer to each other due to global warming and climate change. So we are anticipating that this is not going to be too long. We have seen in the past, I've shown that really roadmap of emerging diseases over time. You can see the last one we had on COVID, remember, in West Africa was 2014. And you can recall the most recent in Uganda. You can recall Marburg in Tanzania and Equatorial Guinea. We used not to see this frequency as closer to each other's. So we just need to be prepared. Let not ask the simulations and the modeling data, but they are all suggestive that is less than 10 years, that we're going to deal with something at the magnitude or higher than COVID-19. So it's not just time to get worried, but it's the time to get prepared. And as we've said, we need to increase our resource mobilization. We need domestic funding, not only in kind, but also in cash, to be sure that we're prepared. And you can see the rest of the world, not only Africa, it was actually preparing for an agreement because we're all aware that the pandemic is coming. And unfortunately, we failed to find an agreement around some sticky points that I mentioned earlier, including One Health, including financing. So basically, my friend, it's not time to get worried, but it's time to get prepared. The pandemic is there, and we have to deal with it. Thank you, and back to you.
Probably to further add what Professor Nikes has said, you will realize that we have had quite a number of pandemics within such a short time. I also mentioned in the chat box, but also there's increased human-animal interaction. So like for the last 10 years, we have had H1N1, 09010, Ebola 2014, 2016, and then we now had COVID, we had MERS. So essentially, with all these other factors, it's evidently clear that the next pandemic won't take long. The question is, how do we take advantage of the existing momentum where there's goodwill at all fronts to ensure that we can be ready for the next pandemic, not only to control it, but to be able to prevent it if possible, but also to be able to control it. Over. And I think also you also raised the question about funding. One of the things has been done is that we should start to be able to address what we consider our priorities, whether it's funding that it comes either from the continent or out of the continent, whether it's philanthropic funding, whether it's from government. And one of the things Africa CDC has done, and I think the document is online, is that they have worked with the various institutions, member states, partners to identify priority pathogens, whereby then they should be based on what our burden is, based on our priority needs, which then should be able to be given that particular focus. So I think if we do so to avoid a situation whereby we are running helter-skelter, then we can have a focused way of addressing what affects us most and what probably is not our priority. And then as the funding comes in, is directed to where the need is required most. Over.
Okay, thank you very much, wonderful speakers, for that. I don't know if Mr. Nathaniel wants to add anything. And I would like to request you to kindly put on your video for pictures, if you don't mind.
Okay, thank you very much. I think most of my, has been well elaborated by Professor Ndembi and then Dr. Ondari. But what I just want to add is, and I've seen some of the questions from the chats about opportunities, what is happening on the continent, whether we are ready. I want to speak and say that from the African Union perspective, a lot is happening in terms of getting ready with human resource, in terms of building a certain momentum. And like Dr. Ondari said, the momentum is there, the goodwill has come. post-COVID. Let us take advantage and move it through, because if this opportunity goes by, I'm not sure we'll have this momentum again. So what is happening is that a lot of technical working groups have been formed, and the next discussion is to move to all the countries on the continent in terms of the training capacity and then information sharing, because it looks like most countries are not aware of what is being done on the African Union perspective in terms of the guidelines that are being developed to have a harmonized guidelines in terms of information sharing, in terms of even training for researchers. So that the Afro-ADVAC is a very interesting program that is designed for researchers across the continent, and it's done every year. So those on the online can quickly Google and look for that information, and you can ascribe. It gives a lot of information on the vaccine platform that are happening, the training that are being done, so that we become abreast with time what is happening on the continent. Otherwise, before we realize, we are also being left behind. Yes, the pandemic. I know the person who asked the question might be a bit worried, but like has been explained, don't get worried. It's better to be prepared than not to be prepared and be caught off guard. So the idea is to start preparing now, have a plan in place. Even if there is none, we can do a mock-up or what we call a targeted type of planning to be sure that when it happens, this is how we treat it, so that we are not left off like we had in the COVID era. Over, and thank you very much.
Thank you very much for that. I sincerely apologize about Dr. Dodson's reception. Where he currently is right now, that's a very bad network. So right now we are coming to the end of the webinar, and we've spent close to 2 hours. And we sincerely want to appreciate our speakers and our participants for taking the time to join this webinar again. So I would like to mention our activities. Here in GET Consortium, we have an annual conference, and the next one is coming up on the 6th to 8th of November 2024, which is the 10th African Conference on One Health and Biosecurity. So we will also be celebrating our 10th year anniversary. And the theme of this conference is From Ebola to COVID-19 and Beyond, Strengthening Africa's Capacity to Address Emerging Global Health Security Threats. So we'll eagerly anticipate you joining the conference. The registration will be open soon, and would like everyone to register. Also, we have a GET Journal of Biosecurity and One Health. This journal is a platform for researchers and everybody in the field of biosecurity and One Health and all related fields to publish their research articles for free. So right now, we are currently accepting manuscripts for the volume 3, issue 1 of this journal. So please, you can check our website at www.getjournal.org. So right now, I sincerely want to appreciate all our speakers again. Thank you very much for joining this webinar. Thank you for honoring our invitation. And so our participants, GET webinar series cannot continue without the participants. Thank you very much. And we would like to request from the speakers, can we share the presentation slides with our participants? I can see almost everybody is requesting for the slides. So if you don't mind, could we share the presentation slides to the participants?
Sure.
Okay, thank you very much. So we'll be sharing the presentation slides to all our participants, and there will also be a certificate of participation for every registered participant. So right now we've come to the end of the webinar. The recording session of this webinar, it will be uploaded on our YouTube at Get Africa. Thank you very much, everyone, and see you at the next edition by June. Bye.
Bye.
Bye.